Years knows that I'm obsessed with Hydrolyte. In my opinion, the best oral rehydration product on the market. I literally use it every day. My family uses it. When I had COVID, I'm telling you, Hydrolyte contributed to my recovery, kept me hydrated. Now, with things finally reopening back around the country, the potential exposure to the common cold is always around. And like always, Hydrolyte has got your back. Hydrolyte Plus Immunity, my new favorite, starts with their fast-absorbing electrolytes and adds a host of great ingredients. Plus, each single serving easy pour drink mix contains 1,000 milligrams of vitamin C, 300 milligrams of elderberry extract. Hydrolyte Plus Immunity comes in convenient, easy to pour sticks that rapidly dissolve in water, make a great tasting drink, has 75% less sugar than your typical sports drink. Uses all natural flavors, gluten-free, dairy-free, caffeine-free, non-GMO, and even vegan. Hydrolyte Plus Immunity is also now available in ready-to-drink bottles at the Walmart next to the pharmacy. Or as always, you can find it by visiting hydrolyte.com/Dr. Drew. Again, that is HYDRALYTE.com/DRDREW. Be sure to use the code Dr. Drew 25 for a special discount. I want to give a shout out to our good friends at Blue Mics. If you've heard my voice on this show anytime over the past year, including right now, you've been listening to Blue microphones. And let me tell you, after more than 30 years in broadcasting, I don't think I have ever sounded better. But you don't need to be a pro or have a fancy studio to benefit from a quality mic. You may not realize it, but if you've been working from home or using Zoom to chat with friends, you probably spend a lot of time in front of a microphone. So why not sound your best? Whether you're doing video conferencing, podcasting, recording music, or hosting a talk show, Blue has you covered. From the USB series that plugs right into your computer to XLR professional mics like the Mouse or the Blueberry we use in the studio right now. Bottom line, there's a Blue microphone to fit your budget and need. I can't say enough about Blue mics, and once you try one, you will never go back. Trust me. To take your audio to the next level, go to drdrew.com/blue. That is drdrew.com/BLUE.
Hey everyone, it's a dose of Dr. Drew.
Here we are. Thank you. A happy Indigenous people, Columbus, whatever we're calling this day. I'm all for all those evolutions. A lot of love for Susan on the restream today, Susan. I don't know if you're noticing that.
I know. I got my booster.
They're very excited that you got the booster. And,
I don't know. I just felt it. I was driving back from Lagoon and I went, you know what?
Yeah.
I'm going to get the booster.
So I am a big fan of the booster, particularly if you've had a no reaction to the initial vaccine. I have seen some sort of not so pleasant reactions to the third one, even if you had nothing on the first two. But even then, it's transient, of course. And the Pfizer vaccine does wear off, and so it is important to get that booster, particularly if you're over 65 or if you have any risk factors. In our case, we're traveling a lot and that kind of thing, and so I really am uncomfortable with Susan not being fully.
I'm not going to get a false sense of security until what, 2 weeks?
2 weeks, yeah. But even so, I mean, you're probably good. But I'm waiting on my Auditory score, which reminds me, I've got to bug them
I know,
again.
I couldn't wait. Because if I waited, then I would. Okay, we're leaving for Austin on Thursday.
No, I want you to get the vaccine.
Then we're going to.
I think it's a good idea.
Then we're going to New Orleans. Then we're going to, and I just couldn't wait for the Auditory score. We'll see.
Yeah, and it'll be interesting to see if your score is down, if it's concerning at all, or if it's up. You know it's going to be better. So I have heard nothing about the score.
Thank you, Ashley. Ashley said I'm precious. Thank you.
Has she met you?
I know.
I have a lot of words to describe my wife, but precious is not so much.
I think we have met.
Okay, good. All right.
I didn't tell you about her.
Hey, Hitler. Okay. So on Locals today, someone sent me a note asking about talking more about childhood sexual abuse. And, I spent 30 years doing that on Loveline. That's about all we talked about because we went through a period from roughly 1965 to maybe to 2000 of a pandemic of childhood sexual abuse. Now, childhood sexual abuse shatters child development. It literally takes a piece of you First, it disconnects you from your body. It causes something called somatoform dissociation. So the body, depending what age you were abused, becomes, and it can happen at any age to be fair, if it's persistent and chronic and that kind of thing, the body becomes a source of unregulated, scary information that doesn't get properly integrated with the rest of the central nervous system. So it's literally called somatoform dissociation. In addition to somatoform dissociation, that kind of severe sexual abuse also causes psychological dissociation, which is all mediated through the vagus nerve. I don't know if you remember that movie with Sidibe, what's her name? What was that? It was called Precious, strangely enough, right? Her entire name was Precious. And she had these dissociative episodes about sexual abuse. It is a little weird, isn't it? And the sexual abuse causes your brain literally can't manage it, so it pulls away like it goes somewhere else, right? So you see yourself outside your body, or you black out, you disconnect, and those parts of yourself then become walled off from the regulatory system of the rest of your brain. Now, when the body is the source of unpleasant input like that, you dissociate literally from the neck down. And so people will get all kinds of unpleasant pain syndromes. Hey, it would be nice if I'd comb my hair before I sat down, wouldn't it have? Meh. Let's see. Andrew has some thoughts on countries banning Moderna for under 30. Andrew Ashkazvili, I'm not surprised by some of that. Again, we have elected in this country to be extra aggressive and not put safety first. Clearly, as compared to other vaccines, we've been more aggressive with this one. It seems like that's a philosophical approach that we have adopted. Has it been a bad move? I'm not sure it's been a bad move. I don't think so. It's been a little concerning because it's added to some of the vaccine hesitancy, because you're not being forthcoming with what you're doing. You're hiding, and to some extent, what you're doing. But that's the only thing that bothers me about it. Okay, my mic is fully peaked. My levels are too high. So is this for men or women? What am I describing? Asuka Shin just saying, it is for men and women, what I'm talking about. But women were more commonly the object of sexual abuse for a long period of time. But yes, it's for men and women. And so when people get chronic pain after sexual abuse, like pelvic pain, the pelvis was the source of all this overwhelming neurological input during childhood, and it activates a part of the brain called the insular cortex, which is sort of the part of the brain that's responsible for the affective part of pain. Pain has a somatic piece and an affective piece. So the somatic piece is, I hit my finger with a hammer, it hurts, but there's also panic and anxiety and misery and all these other emotional components that go with it, and that's the insular cortex. And that is what becomes particularly unregulated in terms of the information coming out of the body with people who've had sexual abuse. So the body is mysterious, disconnected, a source of pain and panic and unpleasantness. The self is actually fractured a little bit, so parts of the self are not present. Now, trust me, those parts of the self that are not present in the conscious mind still demand attention. And so that demands attention through attractions and acting out behaviors and emotions. It's still there, sort of generating unpleasant feeling states, let's say. Okay. So that's the sort of setup of sexual abuse. If you watch the interview I did with Dr. Alan Shore, you will see he is sort of the father of interpersonal neurobiology, and he's the one that created that really developed these observations and frames through his neuroscientific observations. So you might want to look at that. Now, having said that, I was sort of thinking about this today, is why I was interested in bringing up this topic. I was talking to a woman that helped me write the book on narcissism. And I asked her, I said, do you remember that I was preoccupied with writing a book about, no, I wanted to write a chapter about pre-revolutionary France because I could not find a period of history where childhood abuse was as common as during the 60s, 70s, and 80s in this country. I just couldn't come up with a period of history except pre-revolutionary France, where the abuse of children was absolutely rampant. And I was saying, I want to write a chapter about what happens. I wanted to talk about the madness of crowds and mob behavior in the French Revolution and scapegoating, because I knew that was coming. I knew some sort of scapegoating process was going to come forward. And lo and behold, here we are with social media being the mob action and cancellation being the modern guillotine. And she did remember it. She remembered how badly I wanted to write it. And we're thinking about writing another little story about that to attach to another book. But isn't it interesting that today, I don't know if who wrote me wants to be, you can, if you're listening, you can get on the Restream and say it's you if you want to do that, but I'm not going to out anybody. Someone who alerted me to talking more about sexual abuse, which is something I've done my entire career. All of my patients with drug addiction had some form of childhood abuse, neglect, physical abuse, sexual abuse, all the above. They all did. And it's funny, I was giving a talk once about it was about addiction, really, and I was talking to a psychiatric friend of mine, a guy I really admire, and I said, all my patients have sexual and physical abuse. He goes, no, don't say always. Don't say always. I go, okay, I won't say always. I know in medicine you don't say always or never. That's just where we're trained. Don't say always. Don't say never. By the way, any of you who are new to biology and now have adamant beliefs about vaccines, we are trained to never say always and never in biology and in clinical sciences. So I got to the podium and I said, I was advised by my colleague not to say always, so let me reframe my position. When it comes to childhood sexual abuse and physical abuse and abandonment, I don't always have, this is not always the case my patients have that, but 100% of my patients have that. It's 100%, 100%, never otherwise. So in other words, if you have bad enough addiction that you need to see me, there's a 100% probability that you had childhood sexual abuse. And the reason is, we talked, if you've been listening to this stream thus far, I've explained how you get somatoform dissociation, so the information out of the body is disorganized and overwhelming. You get dissociation, so you can't regulate emotions that are difficult. They become too prolonged, too intense, and they get walled off. You just sort of move away from them. They don't get managed. So you end up in pain. And walking around in pain, unregulated, with emotions being too prolonged, too intense, and too negative, and you find your way to drugs and alcohol, and that helps you, and you're 17, you use it. That's what you do. Now, some of that is genetic, right? You have to have a euphoric effect, a pain-relieving effect from drugs in order to gravitate that way. Like for me, when I take opiates, I feel terrible. I feel worse, which is, I feel, it's kind of concerning for me if I ever need to take them for something significant. But I don't like them. They make me feel uncomfortable. And my patients cannot understand that. Anthony Brown is
When you got COVID, you were begging for him, though.
My back pain was so bad, but it didn't do much. It really didn't do much.
I was with Adam at Mark Garagos's Christmas party, and I go, Drew's asking for narcotics. He looked at me with this really scared look on his face.
Who did that?
Adam.
Adam was scared? No.
No.
You project. Adam does not
It was
experience
like,
fear.
uh-oh, this must be bad, because
no.
he wants... No, he did. He gave me a look. Because he knows you don't like narcotics, so...
Okay.
I know. He showed some kind of concern. Is that?
It was not fear. He does not have any anxiety.
Well, he had
that's one of his
what would it
flaws
be?
and superpowers.
What would that look be like? Concern.
Concern. Concern.
He can show concern.
Yes, he can show concern. He could do that.
I'm not sure what it was.
So, do I think we will have another wave this fall or winter? I think we should. Well, we're either going to have another wave or we're going to kind of stay at a plateau of 60 to 100,000 a day, because that's what endemic is. Endemic means we have lots of cases. It's not pandemic, it's endemic, and we're living with it. And I've told you repeatedly on this stream that the new antiviral medications are going to make a huge difference. It is not a new I-word medication. There's the effectiveness of this new one is literally thousands of times greater than the I word. And those, the early treatment medicines are like, okay, they're around the margin, they're something, maybe we can do a little something for some people and maybe get some sort of, epidemiological effect, but it's not much. But this medicine is going to make a huge difference. So most of us are going to need to get infected, have the vaccine, get infected, have mild illness, treat it with an antiviral. That's how we're going to get broad, sustained immunity. The CDC said that at one point, and then they pulled it off their site, which I found interesting. Literally thousands. Yeah, I would say thousands of times more effective. I mean, in other words, it's very hard to document the efficacy of the eye medication. It is not hard. This one has cures and prevents hospitalization of most cases. It's a very different thing. Very different. I guess the thousands, so to speak, depends what we're measuring, right? I mean, it's a false equivalency in some respect, because all I can say is that one might have some epidemiological effect. In other words, maybe, and it's being studied, that it could, maybe for a tiny percentage of cases help things not progress to more moderate, severe cases. Well, this one categorically does that almost always. And that's the difference. It's almost a digital difference, a yes-no kind of difference. So you'll see. You will see. It's going to make all the difference. How many pills in the antiviral treatment regimen for the average patient? I believe it's twice a day for 5 days. So 10 pills. And no real side effects. I mean, there's just been no side effects. That's the other thing. Has anyone died from the flu? There's been very little flu this year, and that's why they're concerned this season is going to be more severe. Oh my goodness. Cornea transplant, TikTok eye doesn't make me a cool guy. No, Adam, it does not make you a cool guy on its own. No. It comes with a package of certain kinds of behaviors, you know well. Somebody's saying something about my MD from USC and my undergraduate degree at Amherst College. I'm not quite sure what you're saying there. Yeah, Dr. Z has been talking about using early treatment and things, and he has vitamins that help people. And yeah, I'm all for all the things we can do that have very little risk. I'm all for that. But when we come up with it's the difference between an antibiotic, it's the difference between taking an antibiotic and drinking cranberry juice. I mean, if you have urinary sepsis, cranberry juice is going to do nothing. Antibiotics will cure it in the vast, vast majority of cases. Hi, Dale in Texas. What else you got in you guys' mind? How does the efficacy of Merck drug compare to something like Tamiflu for influenza? George Clark, this is much more effective. The Tamiflu is decent. It reduces some of the severity and reduces some of the transmission in the home. I've looked at this data. It looks much more effective than Tamiflu. Much more. It's more like HIV and AIDS. In other words, HIV and AIDS antivirals reliably take that infection from a death sentence to a chronic illness with no complications. So I think that's more the way to think about it. Gut health and susceptibility to COVID, not that I've seen yet. People have tried to make that case. I've not really seen anything. I mean, gut health is just a good idea to pay attention to, much like exercise and, carbohydrate intake. Will J&J allow a booster? I don't know quite what to think of that yet. I'm waiting for my Outtakes score to see if I can figure out what the J&J did for me and whether I need a booster. So far, what it looks like they're going to come out with first is that the J&J is going to be a 2-part vaccine instead of 1-part vaccine, separated by 8 weeks. I think that's the first thing. Whether or not they booster the people that already had the single vaccine, I don't know. I just don't know. All right. Okay. Gagging and throwing up by breathing through your mouth. I do not know. Agabaga? I do not know what that's. Yes, Nathan, undergraduate was in biology. I was trained in biology. And I had very, very, very good training in biology, as a matter of fact. And it's informed me ever since. And that's why I'm sort of impatient about the public discourse about clinical phenomenon. If people have never studied biology, it's not a linear phenomenon. It's more like a cloud. Think clouds are a better description of how biological systems work than a chemical reaction, for instance. Let's see. Jay is being forced to get the vaccine at work. Adam, cryptic tonsils, interesting idea. Okay, third dose plus over 65 flu vaccines. Dale, I'm not quite sure what you're asking. It looks like you can't take that all together right now, but that's not been formally assessed, but it's being assessed, I know. It hasn't been formally sort of adjudicated, so. What will happen when Eddie needs a prostate exam? Sneaky Guatemalan. That is a great, great question. And I'm going to see Annie in a few days, and I will ask him that. That is a great question. What is he going to do when he's 50? What's he going to do when he needs a colonoscopy? Think about that. I think I did mention that to him, and he freaked out. I think the reason it's got a big hook on it like that is so it doesn't go all the way down and get lost into the bladder, right?
Oh, my God.
Yeah, which can certainly happen.
Have you heard of that happening?
Oh, yes, I have.
Of people losing sounding devices?
Yes. Anything you can put in the anus or the urethra has stayed in the anus or urethra. Yeah, yep. That's like what happens in Vegas stays in Vegas. I think I like that construct. I like that. What happens in Vegas stays in Vegas, and that was a little outtake from this week's Dr. Drew After Dark. I can't hear you, Susan. Your music is overwhelming.
Why the hell is music playing?
I'm not in charge.
Maybe it just means we have to have another one of these.
I like the way Dom's like, never thought about it. Huh?
Yeah, I was like, I never thought about the way I come, Drew.
Yeah,
that's very interesting.
And it's it's as different as facial features and other stuff. It's just weird, kind of interesting organisms.
Also, follow-up question, Chris, how do you come?
I'm so glad you asked.
Poor Chris. Chris is the normal one in the group there.
So I get to be on the show.
I know. I don't reveal too much.
I get to be.
Yes.
I don't know.
I might keep you for 2. I don't know. We'll see.
What you guys are up to. They just.
Oh, I called Nadav today.
Nadav just said he would.
Oh, yes.
He wanted to know if I would come.
It's the only thing I worry about with this vaccine. If you're still kind of under the weather
I'll be
when
fine.
I need you.
Oh, stop it. You guys, I'm fine. The last time I was fine.
You just slept for
the hardest
7
part
hours.
is not having a cocktail, so I'll be fine. Don't worry.
TS, how
and
come
think
Eddie
about
can't
this. I'll
poop?
be sober.
Oh, yeah, about
You'll
that.
get your wish.
How about that? We'll see how that turns out. TS,
I'll be fine.
How come Eddie can't poop? He holds it. He has a withholding problem, syndrome. And he and I got some very interesting conversations. He's been very open about his psychopathology, and he also has.
Do I have to talk about my poops?
No. Only if I go. Well, who knows? You never know. You really don't know with that show. You really don't know.
Well, I had a bite of a Thai crab thing the other night. It was so spicy I couldn't eat.
Speaking of Thai crab, did you get my order? I texted you.
I'm working on it.
Okay, thank you.
You don't want any? Do you want any fish or anything on your salad? Or
well, I ordered 2
chicken?
salads. I ordered 2 salads. One of them is made with fish.
Okay.
Look carefully at my little order there. Okay. Got COVID 3 weeks ago. Here's San Fernando 2 stories. Treated with monoclonal antibodies, mild illness, fantastic. Get badly fatigued once a day, which lasts about an hour. Is this common? Absolutely, my friend. Fatigue is a big part of the post-COVID syndrome. If that continues, I would talk to your doctor about fluvoxamine. I had severe fatigue for weeks afterwards, and the fluvoxamine helped it in 30 minutes. It was unbelievable. It really was crazy. How do I feel about methadone? I am not a fan, Mike. I know that it has saved some lives, but the thing about methadone is, once again, physicians don't know how to choose the right patient for the right treatment, and methadone is a life sentence. You're not coming off methadone.
That salad looks good.
I know, the 2 salads.
Shrimp, sweet
salads,
jumbo
right?
crab, pico de gallo. You don't want that, right?
Yes.
Oh, you want the pico de gallo?
No, everything on the side.
Jicama, avocado, olives, champagne.
That's the salad made
You
of
want
fish,
the
Casey.
Champagne vinaigrette?
Yes, on the side. On the side.
Okay.
Mike, tangerine, interesting idea. Bring my Catherwood in. So methadone, yeah. So I'm not a fan. I've had to take many people off of it. It's been a horrible disaster. Now, these days you can switch over to Suboxone for methadone, and that has changed our ability to get people off methadone, to be fair. So Tom Cigars thinks it's a business model. How do I get off methadone? Mike says, Suboxone. You switch over to Suboxone. You have somebody who knows how to get, it's a challenging little switch, but there are doctors that are very good. Dr. Bruce over at, he's now at, I think, Loma Linda, and or Kaiser like Riverside. You could look him up. What is Bruce's Twitter handle? They could, I'm sure, DM him or follow him.
Dr. Bruce H.
Dr. Bruce H. Send him a tweet and tag him, and I bet he can help you out. But it's dicey. You got to be on a pretty high dose of it, and then you got to come down off that. But that's much, 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 much easier. Okay. Yes, Anthony, of course, is going to point out that people are abusing Suboxone, which absolutely true. I'm not a Suboxone fan either, though it has saved lives, and it can be an important instrument. It's an important important tool. It's just I didn't like it because for years it was every opiate got put on it no matter what. That was the treatment. And it's again selecting the right treatment for the right patient. That is the challenge in medicine always. Okay. I don't know how much longer for some reason I'm kind of tired today. I don't know why. Does fluoxamine help with horrible migraines experienced by long haulers? It might, Kat. It might. I would give it a shot. I see almost no downsides. Now, not everyone has a kind of positive response that I did, but I'm very... Also, they're using Pravachol for long haulers with headaches and fatigue. Mike has chronic pain. Yeah, Suboxone absolutely is the best. As far as I'm concerned, Suboxone is the best medicine for chronic pain that we have. And again, Bruce is now an expert in getting chronic pain patients off multiple different opiates onto just Suboxone and using that to manage their pain. And his results have been amazing, amazing. Suboxone is better than fentanyl. That's right, Miss Kaylee, for sure. For sure. And, if you're treating somebody on the street with multiple diagnoses and no resources and medical problems, yeah, Suboxone could save that person's life. No doubt. Yeah, Nathan, it's impossible to wean off methadone. It's impossible. You can get down to about 20 milligrams sometimes. Once you're below 20 milligrams, you're going to feel terrible. I used to take people off methadone cold turkey, but I would never do it unless they got down below really 15 milligrams. And getting them there was tough. All right. Hypothesis. Adam Schmidt. Potter did not have those kinds of fish. He didn't have fistulas. He had a pilonidal cyst. Yeah.
Don't tell me.
A wasp killed a wasp next for my pediatric endocrinologist neighbor. She called me amazing. Well done, Chris. Sam, what do you feel bad asking? Did we hear back from Gary Brecka? Susan, what's going on with our results from Gary? Because he suddenly went to Dubai. He had a big meeting over there.
They were going to come. And
they were going to come this weekend.
And you were working. And
yeah, we're trying to get it together.
In person.
Yes, they want to give us the results in person. I know. Susan wants to take some exosomes. I'm sort of interested.
I'd like to.
I'm interested in NAD infusions. I think these things are good.
They're expensive though.
Are they? Yeah.
I was trying to trade out. I don't know. Do I want to spend that kind of money on?
Mm-hmm. Let's see. Okay, you guys. Yes, it was a fluid-filled sac. Is what a cyst is. He had a pilonidal cyst, and it was infected, and it had tracked all the way up into his spine. So that's
still talking about that.
If you look at the video where I sort of explored it and packed it, it was good times. People, poor Nadav, I thought he was going to throw up or faint on that one. Any treatment for spinal stenosis? Maria, there are treatments for spinal stenosis. There's a lot of good surgeries, but again, it's different for your cervical spine than your lumbar spine. For your cervical spine, it can be very, very important because you can end up with some nasty complications. With the lumbar spine, unless you're having motor problems, the surgeries for even spinal stenosis are sort of unsatisfactory. They're not horrible. Some of them work okay. But it's challenging. Once you have a lumbar surgery, you're usually looking at more lumbar surgeries. That's the bad part. How do you regulate GABA when coming off alcohol? Shink, you're being way too specific. You're saying, how do you deal with alcohol withdrawal, which is a global brain system? The GABA system is one of the systems that you can stimulate to reduce some of the withdrawal symptoms. And it is, that's Librium. That's what we use. Librium. We use anti-seizure medication, mood stabilizing medicine. We use Cirax. We use, intermediate acting benzodiazepines tend to be very helpful. Surgical treatments for trigeminal neuralgia. Yeah, Kat Dunleavy, they actually are. Some people with trigeminal neuralgia actually have nodules on their trigeminal nerve. And there are a couple of surgeons, only like 2 in the country, that do these very involved surgeries that go in there and try to scrape off the nerve without destroying it. So that's something to look into. And again, you have to have those nodules. I mean, there are many causes of trigeminal neuralgia, but one can be actually a little growth on the nerve. And somebody's asking about Potter and his problems. Yeah, he improved. He improved.
His pussy back?
No, his problems with girls.
Oh.
Things got better.
Have you ever seen him?
Have you ever seen him? Mm-hmm. Oh, me?
Yeah.
Yeah, I did. I explored his abscess.
So I think Anthony Brown wanted to know when I got my booster. I got it today
Yep, just got it.
on my way home. Just popped in and they gave it to me and talked my ear off.
Oh, really? The pharmacist over at
Yeah,
Kellogg's?
the young, sort of tall, skinny girl. She's pretty funny.
The one that's at the cashier.
She just tells me everybody comes in to complain and rant all the time.
About
now.
what?
Everything.
Oh, that's so funny.
Politics.
Welcome to Pasadena.
Yeah, their gender not being recognized at Home Depot. Stuff, just crazy stuff. And she's so funny. She goes, we like listening and we like talking, and but people just like to unload on us all day.
Yeah.
Well, and then you get sick people in there, and they're grouchy anyways. But they're so funny. I came in, they were so excited.
Oh, we
She
didn't see
said
you
she saw you on a show, and she was very impressed with your take on COVID.
Oh, really? What was I on?
One of those.
One of these shows, I suppose, right?
No, I don't know. I can't remember. She didn't tell me.
Yeah,
She said I saw him on YouTube the other day.
Oh, it was this show.
Oh, maybe, yeah.
Yeah. Mary O says.
And then she was mad because doctors were getting slammed.
Oh, yeah. Oh, talked to you about that too?
Yeah. They're funny.
Did she want to order? Did she need an order for the vaccine?
No, they don't need it. No, a month ago I called and she said, you got to have your doctor call, and now you can just walk in.
Good. That's how it should be.
Yeah.
All right, good.
And I think my insurance may have covered it. I'm not sure.
Okay, Mario, does propranolol, which is Indrol, prescribed for dystonic familial tremor, help with D? I don't know what D is. Susan, help me. What's D?
Dick? I don't know.
This is not that show. This is not. So she has a familial tremor, which is a very fine tremor that like this looks about like that, and it's something that gets worse as you get older. And Indrol works very, very well for it typically, but I don't know what the D is.
Why are you asking me?
I thought maybe you would think of it. I don't know. Okay, how accurate is ancestry DNA? It's pretty accurate. In terms of the regions you have come from. Lasix, Sean. I'll tell you my Lasix tale of woe in a second.
Oh, DTs.
Which is, with DTs. Does that? Okay, DTs. Yeah. So delirium tremens, you don't really mean DTs. You mean alcohol tremor. So alcohol has multiple causes of tremor. Alcohol causes a tremor. Alcohol withdrawal causes a tremor. And complications of alcohol withdrawal can cause tremor, and then seizure. DTs is technically cardiovascular collapse. That's when the autonomic nervous system is so disorganized that you end up on a ventilator. The tremor of alcohol withdrawal, which is a bigger tremor, does get better with Indrol, but it won't help much with the alcohol withdrawal. It just helps with the hyperdynamic state that people get into. Some people will use Indrol occasionally. I never used much of it. We just load it up with the benzodiazepines, and the whole withdrawal syndrome would subside. So Lasix, I had PRK, which is radial keratotomy, and I've been left with dry eye. I hear Lasix is even more likely to cause dry eye. If you decide, it's nice to have your vision back at a distance, but man, the dry eye thing is awful, and I hear it's even more likely with Lasix. So I'd be very, very careful, particularly if you're older. And if you're older, you're going to end up with a lens anyway when you get cataracts around 70. So why not just wait till you get the new
why don't they
lens?
just do that?
I know. Okay.
Fuck with your eyes
Essential
like that.
tremors are not that bad unless stressed or trying to do the fine motor stuff. Yeah, and SL Walling, Indrol can help with that. The familiar tremor, in my experience, familial tremor is when it really helps. But any kind of essential tremor. Essential just means we don't know what's causing it. It's just benign. Concerns about long-term antidepressants. I've been on them for 35 years. Now venlafaxine for a while. Consider inappropriate treatment. No. They're designed for long-term use. But I do prefer people to get off medication if they can. I'm for sure. So I have no problem with you trying to get off. Am I getting the J&J booster? Elsa, I'm waiting for my Auditory score. I just sent an email to see if my score was available. So let's see if they respond.
You don't need a booster. You did it in the summer.
I understand, but J&J is going to be recommending a booster. Nope, no response.
After how many
we don't
months?
know. You weren't listening to me. So they're going to recommend a second shot. I know. They're going to recommend a second shot after 2 months. So it's going to be a 2-part series. The question is, are they also going to recommend a booster? We don't know. So we'll see. Let's see. I got a plate on my radial ulna after a break. Does hardware ever get removed? Yeah, it can get removed. I don't know. Talk to the doctor about it. What vaccine is the best? Moderna looks pretty good right now, if you're older particularly. J&J, if you've had COVID, looks like a good way to go. Is the reason for a long haul because of non-classical monocyte? Okay, here comes a good question. Is the reason for long hauler a non-classical monocyte digesting the S1 protein, which cannot then be destroyed, can't go through apoptosis for a long time? Can this be true or the same for vaccine-created S1 protein? The answer, nom nom yam, is I believe yes. I believe yes. At a much lower rate, but I have definitely seen long-haul COVID from the vaccine, and I thought to myself that possibly the mechanisms could be that classical monocyte that Dr. Patterson and Dr. Yo identified. Now, again, that may not be the cause of it, right? That may be an incidental finding, but it was a pretty powerful finding. So I suspect the answer, although it has not been proven, so we haven't proven that that's the cause of long-haul COVID from vaccine, I suspect that is the mechanism, if that mechanism is in fact the long-hauler mechanism. Generalized anxiety disorder, what was my treatment? Long-term therapy. Propranolol conjunction with Invega. Okay, good. Well, does the Invega cause a little tremor? Is that what's happening? Has anyone had a metallic taste in their mouth after a dose of Pfizer? 10 seconds after. I got chills after the J&J vaccine immediately.
Really?
Yeah.
I
You have
felt
nothing.
as shitty as I normally do.
I know. You're bionic. I know that.
My thumb hurt, but then I was like, well, that always hurts. So
Anthony wants to know how long.
I did kind of sit there thinking I got a little nauseous, but I may have felt like that when I walked in. So
Anthony's
you always think it's something, but you
Anthony's
already felt
inviting
that
you to
way.
a meeting while you try to deal with your
My drinking.
vaccine. Yes, your vaccine drinking.
Thank you, Anthony. I'll be fine. Oh my God.
Let's see, Nathan, you're asking lots of good
I
questions.
watched you not drink for like a week. I was very impressed.
2 weeks. 2 weeks. My second week.
Is this your second week?
Yeah.
Wow.
But I don't have that much of an issue.
I know you don't. I don't. I'll be fine.
Okay. All righty. But Nathan, you're asking lots of great questions. I appreciate those questions, so I'm happy to answer them. But Susan, I am a little bit out of steam today, I got to say. Yes, Zach, I remember Minka. That was Adam's favorite guest of all time. In the genetic case, my grandfather's side, I found out a few years ago. I had that since birth. Swelling. I forget what you were asking about that. When teens say they have auditory hallucinations, a voice in their head, how do you know it's the real thing, not just their inner voice? TS, if somebody says they're hearing voices, they're hearing voices, okay?
Unless they're a psychic medium.
You ask them what the voices are saying. Usually they'll be calling out their name. They'll sometimes be persecutory. And so if somebody's having auditory hallucinations, they say, I hear voices. That's a really important thing to get evaluated by a doctor. Really important.
Tom Cigars doesn't want you to go. They've been jonesing.
Okay.
You're tired.
I'm tired. Yeah, I'm tired.
That's why I didn't really plan it in
I really
advance.
want to. What do I think about that? You and I, Susan, need to watch the Dave Chappelle special tonight.
Okay.
I heard he got a huge standing ovation at the Hollywood Bowl last night or night before. I heard Scott Adams talking about it, and it really sounds very interesting to me.
Tom said, Drew, never mind you. This is about me. We're going to be back tomorrow. I don't have the posters up.
Oh, yeah, we got an interesting week. Is tardive dyskinesia a side effect of Seroquel or a permanent condition? Tardive dyskinesia can be permanent. Usually it's sort of transient. Seroquel can cause it. There are lots of good medicines now for tardive dyskinesia. There's something called Ingrezza, Ingrezza. Tell her to look into that. I've had some really serious, there is tardive dyskinesia and there's also tardive akathisia. Tardive akathisia is really rough. Tardive dyskinesia you can usually kind of manage. These are just these are complications of medication withdrawal. Yeah, Casey, Seroquel though can be very helpful for some people. Cito, yep. Let's see. Yes. Who is this? Tangerine Guide. Yeah, I was thinking about Pryor when I was hearing about what Chappelle was talking about, because it sounds like his stand-up had a story to it, an arc, and a sort of built to things, and that is classical Pryor stuff. I urge you all to listen back to Richard Pryor's material. It's modern poetry. It really is. I'm not kidding. Monoclonal antibodies, Regeneron, it's sketchy too, so I'm going to be skipping that as well. Muggsy, I had monoclonal antibodies. It essentially kept me out of the hospital. And I felt better while I was taking it, literally while I was taking the infusion. Zoloft for 5 years. People ever come off? Quackenbush, yes, they do. 5 years is a reasonable period of time to maybe talk to your doctor about trying getting off it. Be careful. You can get a withdrawal syndrome from it, so you want to come off very slowly. Tardive dyskinesia and tardive akathisia, they're not fun. Tom cigars, yes, I'm not surprised you like prior. Buprenorphine long-term, not, again, not that we're aware of. All these medicines I'd like to see you try off for sure. There can be side effects like hair loss and appetite changes and sexual functioning changes, all kinds of stuff. So Kat Dunleavy, do I feel 100% recovered from COVID? I do. I've been struggling with diverticulitis lately, which is my cross to bear as an older gentleman. Stephanie says I look tired. Susan, there you go.
You
So
do?
I'm looking
Well,
tired.
you're thinner because you lost some weight this week.
Yeah, I did.
I don't think Caleb made me a Groberg. What's your buddy's name? Who's here on Wednesday?
Mark Groberg. Mark Groberg is going to be in here. Is he Wednesday?
Yeah.
So Mark is a well-known journalist who's been around everything and just has lots of interesting insights on what's going on now. And he actually went in and testified as a recovering person on behalf of Sirhan Sirhan, the guy that killed Robert F. Kennedy. And he has an interesting story from that.
He's
he
a
has
crack
some
up.
interesting stories about Marilyn Monroe and her demise. And he's
I don't have his banner.
he's been around politics a lot.
But he sounds really interesting and fun.
He is very interesting.
And then tomorrow we have Ryan Hartwig, who's been trying to get on the show for a long time. He was a Facebook whistleblower, and he's pissed that this other person got more press than him. But he has a book, and he outed Facebook a long time ago, and wants to talk about it.
So he's going to talk about the whistleblower tomorrow and his own whistleblowing, so to speak.
He's a
and
That's
everyone's
such a funny name.
now the thread is worrying about my health. I hope I don't look that bad. 'Cause
No,
I don't feel
he's-
bad. I went running today. I worked out today.
He's thinner, but he isn't as tan because he was taking antibiotics. But he looks good.
So diverticulitis is like having appendicitis on the left side. It's a little outpouching of the colon that get infected, and if you're genetically set up for that, it's very, very, very unpleasant when it happens. It takes
I found
a
an
while
email.
to
I was looking
recover.
up our doctor's email
Yeah.
because I was trying to find my blood work from last year, and I saw an email that I wrote to him like, I don't know, a couple years ago, and I was explaining the same thing that you're having now.
That I was having it
Yeah,
then?
I was like,
oh no,
yes.
I've had it.
You get it occasionally.
I get it twice a year.
He can't eat nuts or seeds or, I don't know, a lot of.
So
things.
Slapdash says, asked the question, is it true that Ambien Xanax cannot be prescribed to previous alcoholics? Under no circumstances. I mean, if you need something, for an acute single dose, be prepared, talk to your sponsor about it. But if you're an alcoholic, benzodiazepines are exceedingly dangerous for you. Exceedingly dangerous. Diverticulitis, yes. I did say diverticulitis.
Yeah, it sucks. It's really bad. He was throwing up. Ugh,
Oh, that was
awful.
bad this time, yeah. It was so painful this time. But I feel like I'm pretty good now. So, being treated for complex PTSD, GA, generalized anxiety disorder, bipolar, mommy issues, all the good stuff. Right now, my treatment, I feel like nothing is going to go away. I just need to manage, and the feelings kind of are exhausting. Jamie, EMDR can really help with manage those feelings. So look at trauma therapies, EMDR, that kind of thing, and realize that it's just about turning the volume down on them. I mean, we therapy, we're still the same people, but we can sort of, the symptoms don't bother us as much when you get proper therapy. Opiates and Xanax were not. Oh, really? That's interesting. Well, but now easy. I can't tell you how many people came off alcohol and they got on benzos, how many people came off opiates and got on alcohol. The cross addictions are just as serious. Be very, very careful. Antabuse, Daniel, I'm not a big fan of because if people want to drink, they stop taking their Antabuse. And I've had people try to drink on Antabuse if you get an Antabuse implant or something. So that's kind of dangerous to my and it's a level of structure that's helpful. but it sort of obviates the process of recovery, or it sort of subverts the sense of the importance of the process of recovery. Maybe that's what I mean. EMDR doesn't have a lot of evidence basis to it. Man, I have Angry Bear seen so many people respond to it. Everybody I've sent for it has responded to it. Well, not everybody. I'd say 2 patients didn't like it and didn't continue. Everybody else had a marked, and I mean marked response. And these are people that are usually stuck in some way in their treatment. Now, a lot of it depends on the therapist. EMDR is not a magical treatment. It has to be done by somebody who really knows what they're doing. And that person is really it's just a way of accessing traumatic material and processing it. It really is all it is. And that needs to be done with the therapist in a holding frame. All right. Prescribed Lexapro. Can I continue to use weed? No, Skutnik. The weed is going to work against the Lexapro. Therapy makes you feel worse, Katie Dunleavy. That can happen. And sometimes that's a good thing. I'm not going to pass judgment on that. Therapy should be challenging. You should not necessarily feel happy. And if it's too gratifying, that's not therapy. Therapy should be work. Okay. Let's wrap things up, Susan. I think we put almost an hour in here, and I'm kind of tired. And
43 minutes and 38 seconds.
All right. Is that okay, or do you want to do more?
It's fine with me, honey. Whatever you want to do.
Yeah, I think I got to
It's your
snap this
show.
up. I'm going to wrap it up. And I think we will see you tomorrow with the whistleblower from Facebook. And
Yes, we
see
will.
you on Wednesday with Mark Rubert, who can, it'll be him. I'll just be asking questions and he'll be talking.
Yeah, he's fun. That'll be Wednesday
Jamie,
at the normal time. Tomorrow the show's at 5 p.m. Pacific and 8 Eastern. So because this guy can't do anything till
Okay,
after
that's good.
5 o'clock.
On Wednesday?
Tomorrow.
Oh, tomorrow. Hey, somebody's asking about cannabis and all antidepressants.
And then I guess
Look,
there's
it's
a
not like-
Dodger game on Wednesday, so we got to be
Perfect.
done by 6.
Perfect. He wants to see a Dodger game, no doubt. So here's the deal. Yes, thank you, Shink. I will enjoy our salads. Susan wants a pizza. She's going to get that.
Oh, I've been watching football for 3 days in a row, and I every time that pizza ad comes on, I'm I really want a pepperoni pizza.
I know. It looks really good.
I haven't had kids or grandkids around here. I need to.
So marijuana counteract all antidepressants? Yes, if you use a lot of cannabis and you try to take an antidepressant, that's a terrible combination. But if you are on an antidepressant and you expose yourself to cannabis once every 2 weeks or something, that's a nothing. That shouldn't be a big deal.
Thanks for that comment. Thanks, great show. Whenever somebody on Twitch says great show, that always makes me feel good. Because they're kind of techies over there.
Okay. I will get going, and I appreciate you guys. Susan, you ready to wrap it up?
Yeah, I'm fine.
Okay. And we will see you tomorrow at 3?
No, 5.
5 tomorrow, and 3 on
Wednesday.
Okay, 5 tomorrow.
And then
3
we're
on
going
Wednesday.
to Austin on Thursday, Friday, Saturday. So
Yes, we are reunited with Christina.
But we'll be back the following Monday.
Christina P.
Maybe
and,
Sunday. If anything exciting is
okay, so
going
I'm reunited with Christina P. and the Booth Boys, and then Susan's going to make a rare appearance on After Dark. So something to keep an eye
I got to
out
lose
for.
10 pounds. Jesus.
Thank you, George Clark. Thank you, guys. Alana, Margaret. Thank you, guys. Tom Cigars. Groovy Anthony. Thank you. Somebody's saying 100% great show. Well, thank you, Tangerine. Appreciate that.
Oh, that's so nice.
And I'm just sort of running out of steam, or I would keep going with you guys. But I think we'll save it for tomorrow and get some rest, and we'll see you then. This Dose of Dr. Drew is produced by Susan Pinsky, and a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. The show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your physician, nor am I practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this